Open the form through the Assessment button. Enter the code 1190 or type Pain Flow Sheet. Start assessing the patient by choosing the correct pain assessment tool, such as Verbal for adult and pediatric patients, which is the patient's subjective response according to pain scale of 0 to 10. 0 indicates no pain and 10 indicate worse pain. 0 is no pain. 1 to 2 is very mild pain. 3 to 4 is mild pain. 5 to 6 is moderate pain. 7 to 8 is severe pain. 9 to 10 is very severe pain. Indicate the time of assessment and the pain score on the space provided. Based on responses of your patient to your assessment, tick from the options of each criteria such as location, duration, character, frequency and progress of pain. Tick the box for the nurse, indicating that the assessment was completed by a nurse, and refer to the physician. Determine the intervention to be done based on the pain assessment and physician's orders. Pharmacological refers to any administered pain medication whether through oral, IM, subcutaneous, or 4 routes. Take note that all administered drugs must be reflected on the doctor's communication order, Code 1101. Non-pharmacological or independent nursing intervention provided to the patient such as diversional activities such as listening to music, watching television, conversation and emotional support, warm or cold application, relaxation techniques such as deep breathing exercise, ambulation if tolerated, environmental modification, repositioning or immobilization. Take note that all the independent nursing intervention rendered to the patient must be reflected in the nurse's progress notes, or Code 1208, or in the additional notes. Not applicable refers to the situation wherein the patient's pain has subsided without any intervention. Click the additional notes for any independent nursing intervention you performed for your patient, and the date and time will automatically appear. If the pain tool used is not verbal, click on the question mark icon to view the guide for FRAC, FLAC, NIPS and Wong-Baker pain assessment tools. The reference guide for each pain tool has criteria to come up with a score. Wong-Baker faces pain scale for patient greater than 7 year, which a visual measurement featuring images of facial expressions to help the patient describe the intensity or severity of pain. The patient will be the one to choose the face that best describes the pain. FLAC scale, which refers to faces, legs, activity, cry. Consolability is for children greater than 1 year to 7 years old who are unable to validate the presence of or quantify the severity of the pain. Each of the 5 categories is scored from 0 to 2, which results in total score between 0 to 10. FRAC SCLA refers to faces, respiration, activity, audible, consolability for children and adult who have cognitive impairment, severe emotional disturbance, dementia, and those who have an altered level of consciousness who are unable to communicate the existence and the intensity of pain. NIPS or Neonatal and Infant Pain Assessment Scale is for preterm and full-term neonates. This can be used for monitoring a neonate before, during and after any procedure. After completing the form, don't forget to click the Save button. Thank you.